Marcus Rodriguez didn't get in the ambulance that morning just to transport patients. But when that red bag he'd hidden in the back seat for 15 years was opened, nothing at Metro General Hospital was ever the same again. Because what was inside that bag proved that Marcus wasn't just an ambulance driver. That day, partner Lisa learned who the silent man she'd worked alongside for 12 years really was. And what she learned was the biggest shock of her life. Welcome to Hidden Legends. Before diving into this incredible story, tell me in the comments which city you're watching from today. And hit that subscribe button and turn on notifications, because Marcus's story shows just how big the secrets of the people working alongside us can be. Marcus Rodriguez was the perfect ambulance driver. 52 years old, reliable, always on time, never spoke. He had worked for Metro General Hospital for 12 years. He worked in perfect harmony with partner Lisa. Lisa handled the medical work. Marcus drove and helped silently. They called them the perfect team. Marcus never spoke. Copy. Ready. 5 minutes. That was it. In 12 years, his longest conversation with Lisa was 10 words, but it wasn't a problem. Marcus did his job perfectly. Other EMTs knew Marcus as Silent Marcus. Never complained, never argued, never asked questions. The ideal coworker. Lisa thought she was lucky, but if someone had really observed Marcus's ambulance, they might have noticed strange things. Extra supplies in the back compartment, special equipment alongside standard EMT gear that was never used but always there. And the strangest thing, Marcus never gave medical advice during patient transport. Whatever Lisa did, he accepted, as if he knew nothing about medicine, but his eyes constantly followed the patient. Because Marcus Rodriguez wasn't just an ambulance driver, he was much more than that. November 18th, Friday. Marcus was starting his normal morning shift. He and Lisa were preparing the ambulance. It looked like it would be a routine day. A few patient transports, emergency calls. Lisa asked if there was something different in the ambulance today, noting a red bag in the back compartment she hadn't seen before. Marcus stopped. For 15 years, nobody had noticed that bag. He said it was old equipment briefly. When Lisa asked what kind of equipment, he replied it was unused. Lisa didn't ask further. Marcus usually gave one-word answers. At 7:15, the first call came. Chest pain, 47-year-old male, Pine Street address, routine call. Marcus drove the ambulance. Lisa prepared medically. Normal work. On the way to the hospital, Lisa observed Marcus. As always, silent, calm, focused. Same for 12 years. The man who never changed. But Lisa didn't know that very different things were turning in Marcus's head. He wasn't just transporting patients. He was constantly doing risk assessment, routes, escape plans, emergency protocols. Because Marcus Rodriguez's past had been preparing him for these moments for 15 years. While Lisa and Marcus were returning from lunch break, a dispatch call came. All units, mass casualty incident on Highway 95, multiple vehicle collision, all available units respond immediately. Mass casualty. Every EMT's nightmare. Lisa nervously said they needed to go fast. Marcus silently drove the ambulance to the highway. But internally he had switched to a different mode. This wasn't a normal call. When they arrived at the accident scene, there was complete chaos. 6-car pileup, 2 trucks overturned, casualties scattered everywhere. Fire department, police, 4 ambulance crews already working. Lisa became overwhelmed seeing the scene, saying it was too big, and she didn't know how they would handle it. Marcus silently got out of the ambulance. His eyes were doing automatic triage. Priority 1, Priority 2, Priority 3. Resource allocation, command structure assessment, 15 years of military training was kicking in. Marcus calmly told Lisa to focus on the priority patient, that he would handle coordination. Lisa was surprised. Marcus had never taken this much initiative. First patient, critical trauma, possible internal bleeding, unconscious. Lisa started standard EMT protocol, but the patient's condition was deteriorating. She told Marcus they were losing the patient and asked what they should do. Marcus looked at the patient. Lisa's technique was correct but insufficient. Advanced intervention was needed. He only told her to continue, but internally he was experiencing the critical decision moment. Should he reveal himself or not? The patient's vital signs were rapidly deteriorating. Blood pressure dropping, pulse weakening, breathing shallow. Lisa was giving maximum effort, but standard EMT procedures weren't working. Lisa said they needed to get the patient in the ambulance and rush to the hospital, that there was nothing they could do here. Marcus looked at the patient. During the 15-minute transport, the patient wouldn't survive. At that moment, the instincts he'd tried to suppress for 15 years kicked in. Marcus told Lisa in a quiet but firm voice to step back. Lisa was confused. Marcus had never performed medical procedures. He was just the driver. Marcus went to the back compartment of the ambulance. He opened that red bag. Lisa couldn't believe what she saw. Advanced surgical instruments, military-grade medical equipment, IV fluids not in normal EMT supplies, combat medic gear. When Lisa asked what these were, Marcus didn't answer. He sterilized his hands, started advanced IV access, prepared medications. His movements were suddenly completely different, precise, professional, experienced. This wasn't normal EMT skill level. When Lisa reminded him they were ambulance drivers, Marcus finally looked up. In his eyes was an expression Lisa had never seen: authority, experience, command. Marcus said Lisa was an EMT, but he was something else. Advanced trauma procedures began. Chest decompression, advanced airway management, IV medication protocols. Lisa watched in awe. These movements were professional surgeon level, but the real drama was just beginning. Second patient on scene. Multiple fractures, possible spinal injury, consciousness fading. Other EMT crew was struggling. Marcus assessed the situation. Standard protocols were insufficient for this level of trauma. He told Lisa they needed to go to the second patient. Lisa was shocked. Marcus had never given medical direction before. With the second patient, Marcus revealed his true expertise: advanced spinal immobilization techniques, combat field surgery procedures, fourth medication protocols that only military medics knew. Other EMT crews watched amazed. Who was this ambulance driver? A third emergency came. Child patient, severe trauma, parents screaming. Lisa was in panic. Child cases were always difficult. Marcus immediately took charge. Pediatric trauma protocols, advanced airway management in children, medication dosing calculations. Marcus's expertise extended to child medicine. At that moment, the fire captain realized this wasn't a normal ambulance driver. This was a military-trained combat medic. Advanced level training, field experience, command authority. The fire captain approached Marcus, asking who he was. Marcus hesitated. He had avoided this moment for 15 years. He quietly said he was an Army flight medic, 8 years service, 3 deployments, complete silence. Lisa realized she had been working with a completely different person for 12 years. When she asked if Marcus was a decorated combat medic, Marcus slightly nodded. The fire captain asked more questions. Which unit? Which operations? He said he was 68W flight medic, did medevac operations, served in Afghanistan and Iraq. Lisa was barely breathing, asking why he'd never told her. While Marcus finished packing equipment, he said the past was the past, that he was an ambulance driver now. When Lisa asked why he hid these skills and experience, Marcus gave his first emotional response in 12 years. He explained that doing medicine in war was different, that here was peacetime medicine for people to heal. War medicine was for survival. He preferred peace medicine. When they returned to the hospital, everything had changed. News of the mass casualty save had spread. Doctors from the emergency department came to congratulate Marcus. Dr. Peterson, chief of emergency medicine, told Marcus he'd done incredible work and asked where he'd learned these advanced trauma procedures. Marcus remained humble, saying it was military training and old experience. When Dr. Peterson asked if he wasn't an ambulance driver, Lisa intervened and explained that Marcus was a former Army flight medic and combat veteran. Hospital staff was amazed. The quiet driver who had worked alongside them for 12 years was actually a decorated war hero. Dr. Peterson asked if Marcus had a paramedic license and said he was wasting these skills on ambulance driving. Marcus stated he preferred driving. When Dr. Peterson said he could use his expertise in emergency medicine and save lives, Marcus looked seriously and said he was already saving lives every day in the ambulance. Lisa privately asked Marcus why he chose ambulance driving over a prestigious medical career. Marcus became thoughtful and explained that doing medicine in war meant life and death decisions every second, with pressure, stress, and trauma. He said peacetime medicine should be gentle, and ambulance work gave him peace. When Lisa noted how skilled he was, Marcus explained that skill wasn't important, intention was important. He wanted to heal, not impress. In the following weeks, Marcus became a minor celebrity at the hospital. Everyone respected him differently, but Marcus didn't change his behavior. Same quiet, same humble, same dedicated. When young EMTs wanted to learn combat medicine techniques from Marcus, he always gave gentle responses. Combat techniques were for war. Civilian medicine was for peace. They should learn peace techniques. When they asked about advanced skills, he explained that advanced skills weren't for showing off, but for necessity. And here the necessity was basic compassion. Lisa gradually understood Marcus's philosophy: power in humility, expertise in service, greatness in ordinary work. One day, Lisa asked Marcus if he missed military medicine. Marcus paused long and said he didn't miss the pressure, didn't miss the life-death stress, but he missed the teamwork and camaraderie. When Lisa said they were also a team, Marcus smiled, the first time Lisa had seen him smile in 12 years, and agreed they were a team. Hospital administration offered Marcus special recognition. Marcus declined. He said he didn't need recognition. His work was his recognition. Marcus Rodriguez still works as an ambulance driver at Metro General Hospital today. Same partnership with Lisa, same dedication. But there are no more secrets. The hospital community knows Marcus's background and respects it. The difference: Marcus occasionally gives medical advice to Lisa, quietly, humbly. Lisa appreciates his expertise, saying she didn't know she had an expert beside her for 12 years. Marcus said being an expert wasn't enough, caring was important. When young medical staff ask Marcus for guidance, he always gives humble responses. He'll share experience, but every situation is unique. They should trust their training and their hearts. Marcus's impact at the hospital is subtle but profound. Emergency procedures improved, staff confidence increased, patient outcomes better. But Marcus doesn't take credit. It's teamwork results. He's just a part of it. Marcus's military medals sit in a drawer at home. He never displays them. He says medals belong to the past, work belongs to the present. Lisa asked Marcus a final question about whether he regretted hiding his background for 12 years. Marcus was thoughtful. Those 12 years taught him that real service doesn't require recognition. Real heroes don't have to prove their backgrounds. Work speaks for itself. Marcus Rodriguez's story teaches us this: the greatest service often comes from the humblest places. Marcus could work in prestigious emergency medicine, could lecture at medical schools, could write books about combat medicine, but he chooses ambulance driving. Because real healing starts with transportation. Real service starts with being there. His military experience gave him skills, but his choice to serve quietly gives him peace. Sometimes the most experienced healers don't need recognition, they need purpose. Your ambulance driver might be a combat veteran. Your quiet coworker might have an extraordinary background. Your humble service provider might be a hero. Show appreciation, not for their past, for their present service. At Hidden Legends, we continue to tell these stories, because quiet heroes deserve recognition too. Tell us in the comments, which city are you watching from? Have you had encounters with hidden talents? If Marcus's story inspired you, like the video and subscribe to Hidden Legends. Every day, we share stories of humble heroes. Remember, the greatest expertise sometimes serves in the simplest ways. See you in the next Hidden Legends video.